Many recovering from addiction have chronic health problems, diminished quality of life. Alcohol and other substance use problems take enormous psychological and societal tolls on millions of Americans. Now a study from the Massachusetts General Hospital (MGH) Recovery Research Institute shows that more than a third of individuals who consider themselves in recovery from an alcohol or other substance use disorder continue to suffer from chronic physical disease. The study, published online March 20 in the Journal of Addiction Medicine, is the first to look at the national prevalence of medical conditions that are commonly caused or exacerbated by excessive and chronic alcohol and other drug use among people in addiction recovery. The prodigious psychological, social and interpersonal impact of excessive and chronic alcohol and other drug use is well characterized, says lead and corresponding author David Eddy, Ph.D., research scientist at the Recovery Research Institute. Less well appreciated is the physical disease burden, especially among those who have successfully resolved a significant substance use problem. Incorporating data from the landmark 2017 National Recovery Survey, the current study examined information from a nationally representative sample of more than 2,000 U.S. adults describing themselves as in recovery from problems with the use of alcohol, cannabis, opioids, stimulants or other drugs. Of these, 37% had been diagnosed with one or more of 9 alcohol and drug-exacerbated diseases and health conditions: liver disease, tuberculosis, TB, HIV, AIDS or other sexually transmitted infections (STIs), cancer, hepatitis C, chronic obstructive pulmonary disease (COPD), heart disease and diabetes. The presence of these diseases was shown to be associated with significant reductions in participants' quality of life, and all are known to reduce life expectancy. The study found levels of hepatitis C, COPD, heart disease and diabetes were elevated among those in recovery, compared with the general population. The prevalence of hepatitis C was significantly higher in the opioid and stimulant groups than those who reported alcohol as their primary substance. Lifetime prevalence of HIV, AIDS and other STIs was significantly higher in the stimulant group than in the alcohol group. Factors such as each additional substance used 10 or more times, older age at disease onset, and resolving the alcohol or other drug problem later in life were associated with a 4 to 7% increase in the odds of having 2 or more chronic physical diseases. Although finding that those using injected drugs had higher rates of hepatitis C and HIV may seem intuitive, other findings are not, says Eddy, an MGH clinical psychologist and an instructor in psychology at Harvard Medical School. For instance, those citing cannabis as their primary substance did not have lower rates of alcohol-related liver disease than participants who primarily used alcohol. It may be that these individuals had prior histories of heavy alcohol involvement. The opioid group had the lowest prevalence of heart disease, and diabetes was least common among those who reported cannabis as their primary substance, while there were no significant differences between primary substance groups in rates of TB or COPD. In general, being younger and having more social stability and economic resources, such as higher education, being married or living with a partner, and being employed, were associated with few or no physical diseases. Being female, Hispanic or having a household income greater than $50,000 were also associated with reduced odds of having physical disease. We've known for a long time that chronic and heavy substance use can cause a multitude of diseases directly and indirectly, Eddy says. The extent to which these diseases and health conditions continue to persist for the millions of Americans who achieve recovery remains to be clarified, but this study highlights the fact that these negative impacts may continue to affect quality of life even when people achieve addiction recovery. Earlier and more assertive intervention is needed for individuals with alcohol and other drug problems to help prevent these other diseases, he adds. In addition, addiction treatment needs to be more seamlessly integrated with primary health care, and more research is needed to explore the complex relationships between alcohol and other drug use and physical disease. Are there Zika reservoirs in the Americas? Most emerging infectious diseases affecting people are zoonotic, they make the jump from other animals to humans. Transmission, however, is a two-way street. These zoonotic diseases can also jump from humans to other animals. Even if a disease is eradicated in humans, it can live on in animals that act as reservoirs, ensuring that the risk of human infection is never entirely eradicated. In an attempt to discern this risk for the Zika virus, a team of researchers co-led by an anthropologist from Washington University in St. Louis are trying to determine whether non-human primates in South America have been infected with the disease, which first showed up in humans there in 2015. But first they need a non-invasive way to test the animals for the virus. These animals could be reservoirs and humans could then become infected with the virus from the animals, said Krista Millick, assistant professor of biological anthropology in arts and sciences. This happens in related viruses, she said. There are feedback cycles, where humans are being exposed through non-human primate reservoirs, said Millick, who along with Benjamin Koseler, a postdoctoral fellow in molecular biosciences at the University of Texas, Austin, led the study recently published in PLOS One. The researchers determined that the Zika virus can be detected using feces samples. The virus can be found in a host of bodily fluids, semen, urine, blood and saliva. Getting those samples, however, requires capturing the animals, a risky proposition for all primates involved. The easier option would be to test for the virus in feces, but only one research team has reported success in doing so, and that team did not publish its methods. Ours goes on to provide the method used so people can follow it if they want, Millick said. It's not surprising that there is not yet a method for collecting the virus in feces. Although Zika has been present in Africa and Asia since the 1940s, researchers hadn't been looking for it in the Americas until it arrived around 2015. Once researchers did start to look for the virus in the Americas, the tests available were of other fluids, not feces. That, Millick said, is because wildlife research is often limited by what assays and what methods have been developed for humans. And for humans, she said, you're not going to ask for a fecal sample when you can take a blood sample. The team also wasn't sure if it would be possible for another reason. RNA viruses can be fragile, Millick said, referring to viruses, such as Zika, which have RNA as genetic material, as opposed to DNA. That's the reason we weren't sure if we'd be able to detect it, she said. In feces, the body is breaking things down. And you have a lot more contaminants. In order to measure things in feces, you have to deal with those contaminants. Before heading to the field to test its methods, the team had to make sure its test was accurate. They procured blood, urine, saliva and fecal samples from captive, infected squirrel monkeys that were part of an ongoing study of Zika virus in pregnant monkeys. Using proven methods, researchers tested the blood, urine and saliva for the virus. They then tested the feces, using RT-qPCR-based assay. More about the methods is available in the paper. The results matched. They were able to detect the virus in feces, though detection time windows varied between different sample types. The group has now moved on to testing samples from the wild. So far, the researchers have collected multiple samples from nearly 50 animals. The samples are coming from sites as varied as the middle of the Amazon, where people aren't around and there shouldn't be Zika infections, Millick said, to, unfortunately, animals that had previously been kept as pets. We're looking for diversity, Millick said, not just in terms of countries and species, but also in how close the animals are in proximity to humans. As of February, the team had collected samples from Ecuador, Colombia and Brazil. Ideally, Millick said, people should not be keeping monkeys as pets, nor should they be hunting monkeys, either. In fact, you have a greater risk of sharing diseases with animals when you're either living in close proximity with them or when coming into contact with their body fluids, which is what happens when you kill them, she said, adding that this was how zoonotic diseases such as HIV spread to humans. If the primates are infected with Zika, hopefully the message will not be these animals are terrible, we need to get rid of them, she said. But it will be, we need to respect these wild animals and not come into contact with them. Reducing the burden of tuberculosis treatment. Tuberculosis is one of the world's deadliest infectious diseases. 1/3 of the world's population is infected with TB, and more than 1 million people die from the disease every year. One reason TB is so pervasive is that treatment requires a 6-month course of daily antibiotics, which is difficult for about half of all patients to adhere to, especially in rural areas with limited access to medical facilities. To help overcome that, a team of researchers led by MIT has devised a new way to deliver antibiotics, which they hope will make it easier to cure more patients and reduce healthcare costs. Using this new approach, a coiled wire loaded with antibiotics is inserted into the patient's stomach through a nasogastric tube. Once in the stomach, the device slowly releases antibiotics over 1 month, eliminating the need for patients to take pills every day. Having a system that allows you to ensure the patient receives the full treatment course could be really transformational, says Giovanni Traverso, an assistant professor in MIT's Department of Mechanical Engineering and a gastroenterologist at Brigham and Women's Hospital. When you consider the situation with tuberculosis, where you have multiple grams of antibiotics that have to be taken every day, for many months, we need another solution. Traverso and Robert Langer, the David H. Koch Institute professor at MIT, are the senior authors of the study, which appears in the March 13 issue of Science Translational Medicine and includes a full list of authors. The paper's lead author is MIT graduate student Malvika Verma. The team includes others at MIT, as well as researchers from Harvard Medical School, Boston University School of Public Health, several hospitals in India, and the Tata Trusts of Mumbai, India. Long-term delivery. For several years, Traverso and Langer have been working on a variety of pills and capsules that can remain in the stomach and slowly release medication after being swallowed. This kind of drug delivery, they believe, could improve treatment for many chronic diseases that require daily doses of medication. One of their capsules has shown promise for delivering small amounts of drugs to treat HIV and malaria. After being swallowed, the capsule's outer coating dissolves, allowing 6 arms to expand, helping the device to lodge in the stomach. This device can carry about 300 milligrams of drugs, enough for a week's worth of HIV treatment, for example. However, it falls far short of the payload needed to treat tuberculosis, which requires about 3 grams of antibiotics every day. We had to develop a completely new system that could enable an automated release of these medications over the course of about a month, Verma says. This new system can hold a lot more drug and it can release the drug for a longer period of time. The new device is a thin, elastic wire made of nitinol, an alloy of nickel and titanium that can change its shape based on temperature. The researchers can string up to 600 pills of various antibiotics along the wire, and the drugs are packaged in polymers whose composition can be tuned to control the rate of drug release once the device enters the stomach. The wire is delivered to the patient's stomach via a tube inserted through the nose, which is used routinely in hospitals for delivering medications and nutrients. As part of their study, the researchers interviewed 300 tuberculosis patients in India, and most said that this kind of delivery would be acceptable to them for long-term treatment. In many cases, this was preferred by the patients, who could come to a health care setting every 2 weeks or every 4 weeks instead of having to be seen by a health care provider every day, Traverso says. Once the wire reaches the higher temperatures of the stomach, it forms a coil, which prevents it from passing further through the digestive system. In tests in pigs, the researchers found that their prototype device could release several different antibiotics at a constant rate for 28 days. Once all of the drugs are delivered, the device is retrieved through the nasogastric tube using a magnet that can attract the coil. Cost reduction. The research team included an economist, David Collins of Boston University, who analyzed the potential economic impact of this type of treatment. He found that if implemented in India, treatment costs could be reduced by about $8,000 per patient. The current model for TB treatment is directly observed treatment, short course, where the patients have to come in every day and have somebody watch them take their pills. That's a huge burden for the patients and the healthcare system, Verma says. We envision this as utilizing the infrastructure of the directly observed treatment, but reducing the frequency of administering the treatment from daily to monthly. Another disease where this approach could be useful is hepatitis C, which requires treatment with antiviral drugs for 2 to 6 months. Many other infectious diseases also require doses of medication that are too large to fit in one of the smaller, ingestible devices that Traverso and Langer have developed. In many situations, patients need to take multigram dosages of a drug, but up until now, this has been very difficult to do, Langer says. We believe that this new approach is an important milestone toward addressing this problem. This system might also be useful for delivering drugs that can treat alcohol addiction and other types of substance abuse, the researchers say. The research was funded by the Bill and Melinda Gates Foundation, the National Institutes of Health, the MIT Tata Center, the National Science Foundation, the Alexander von Humboldt Foundation, and the Division of Gastroenterology at Brigham and Women's Hospital. High rate of viral suppression among people new to HIV care. 86% of individuals who entered HIV care soon after diagnosis maintained viral suppression after 48 weeks during a clinical trial conducted at 4 National Institutes of Health (NIH)-funded Centers for AIDS Research (CFARS) across the United States. Participants in the clinical trial, called iEngage, achieved viral suppression in an average of just 63 days. The findings were presented in a poster at the Conference on Retroviruses and Opportunistic Infections (CROI 2019) in Seattle. The findings from iEngage, which was funded by NIH's National Institute of Allergy and Infectious Diseases (NIAID), underscore the benefits of linking people with HIV to treatment services soon after diagnosis and highlight the importance of efforts to engage all people with HIV in care. Provision of effective HIV treatment resulting in sustained viral suppression is a critical component of efforts to end the HIV epidemic in the United States. Notably, many iEngage participants had other medical conditions and unmet basic needs that can make adherence to medical visits and daily antiretroviral therapy (ART) difficult. About half of the study participants reported needing supportive services, including assistance with housing, employment, food and transportation. Mental health issues were also prevalent, with 31% of participants having depression and 30% having anxiety. Roughly 1/3 of participants reported high-risk alcohol use, and 18% reported substance use. Even when facing many other challenges in their lives, the majority of people engaged in HIV care can achieve viral suppression, benefiting their health and preventing transmission of the virus to others, said NIAID Director Anthony S. Fossey, MD. To end the HIV epidemic in the United States, we must ensure that effective HIV prevention and treatment strategies are accessible to all who need them, especially in the areas of the country with the highest HIV burden. The iEngage trial was conducted at clinical trial sites in Baltimore, Seattle, Birmingham, Alabama, and Chapel Hill, North Carolina, participating in the CFAR Network of Integrated Clinical Systems (CNICS). 10 years ago, these sites recorded an approximately 60% rate of viral suppression among people new to HIV care. The iEngage trial was designed to evaluate a behavioral intervention aimed at educating people newly diagnosed with HIV and reinforcing the importance of adherence to care. The 371 participants were enrolled within 14 days of initiating HIV medical care and randomly assigned to receive either the behavioral intervention plus standard care or standard care alone. The intervention, which combined 2 established approaches to enhance HIV medical visit adherence and ART adherence, comprised 4 in-person counseling sessions tailored to participants' individual needs, as well as phone support, during the first 48 weeks of treatment. The intervention did not appear to affect viral suppression after 48 weeks. The high overall rate of viral suppression and the short average time to achieving suppression did not differ between the 2 study arms. The iEngage investigators suggest that recent improvements in standard HIV care contributed to this overall high rate of viral suppression. These improvements include changes in HIV treatment guidelines to encourage early treatment for everyone diagnosed with HIV, an increased focus in clinical practice guidelines on retaining people in the HIV care continuum from diagnosis to viral suppression, and the inclusion of integrase inhibitors, a new potent and well-tolerated class of antiretroviral drugs, in first-line ART regimens. The researchers plan to assess viral suppression rates among iEngage participants at 96 weeks to evaluate whether the intervention improves long-term adherence to care. The findings underscore the effectiveness of HIV care but also highlight the remaining challenges of closing treatment gaps by identifying strategies to engage and retain people with HIV in HIV treatment services. One potential approach could involve incorporating behavioral interventions into communities as part of rapid ART initiation programs, the iEngage investigators suggest.